that music doesn't actually mean anything, but we all agreed it was trendy and that's where I was at. Right, basically, we'd like to introduce ourselves and explain what we're doing and what we aim to do as a charity. What we have been doing has been sort of ticking away in the background for the last year and a half at BCRT. Some people are aware of that. I mean, not masses, because that'll become apparent to speak to you as we go through these slides. But first of all, just want to explain who we are. The trust was set up by the family and friends of Luke Bradwell, who was an osteosarcoma patient. Obviously my son and Hannah's brother. Luke died last year from metastatic osteosarcoma. And we're still, between us, the family is still running the charity as the trustees. And what we wanted to do, because of the way Luke had approached his illness and the treatment, because he was so positive and determined to beat it, although he didn't, was we wanted to try and do something that may help other people that found themselves where we were, or where he was. So our aim, what we aim to do, is raise awareness. Primary bone cancer is our main objective. And this is one of the most important things, as far as we're concerned, and that's backed up by other people in the room who've backed it up for us, regarding, or one of the most important factors regarding outcome. Now, an important word for us is empower, because what we're looking to do is empower people with information. The aim with that is to make, ultimately, long-term late diagnosis a thing of the past. And we know from both the personal experiences this morning, from both Tony and from Son, sorry, I haven't met you before, so I had to look at your name, that this is an issue. Now, as well as that strand of our charity, the other thing we're trying to do is raise awareness in secondary schools. Ultimately, what we'd like to see is every school leaver in the country having a basic level of knowledge about the symptoms of not just bone cancer, but all cancers. So that eventually everybody in society has a basic understanding of what they need to look out for. Now we know we get that, it's in the press, it's on television, it's on tubes, it's on silent buses, that there are things that we should all look out for, whether we're male or female or whatever, yeah, for particular cancers. But we believe that if every single person has a basic input, which didn't need to be very long, once in their life, they'll go into life more prepared, and that will assist with early diagnosis. Well, I suppose in many ways it's a pretty obvious question to answer, but we didn't have any idea of what an osteosarcoma was prior to Luke's diagnosis. In reality, we didn't really know what bone cancer was. We knew that bone cancers exist in general terms because cancer exists. We know that, and we know that cancer is a very dangerous disease, and it can be anywhere. So obviously it could be in the bones, but we didn't know it was any different than any other cancer. But because we've come into contact with patients, and obviously the medical professionals that we met along that journey, we know that that's the case for many people. It's common, and that we think is a problem. Right, so what we did was we rang BCRT. Most of our contact has been with Roger, Jill and Harriet prior to removing, obviously. But also we spoke to Craig and one or two other key key people along the way. And after some lengthy discussions with particularly Jill, Harriet and Roger, we formulated a basic plan, and they agreed to support us in this plan. So this isn't something that's just cropped up, this charity. You know, it's been discussed with yourselves, although most of you didn't know about it. But there's reason for that. So we agreed to work towards a common goal, which is obviously raising awareness and trying to make late diagnosis something of the past. Now, as well as speaking to BCRT, we also spoke to NICE at some length, the National Institute for Health and Clinical Excellence, because it's important, obviously, for us that what we're saying is correct, and that's very important for other people. Now, there's some key things that NICE told us, which I'm going to read to you, which is like facts and things, so it's not quite old word. They highlighted the following points. One of them is public awareness of sarcoma is low, and many studies have shown that some patients wait considerable time after the onset of symptoms before seeking medical advice. So what they're saying nationally as a health service is that we, as members of society, let our symptoms build up, we don't go to the doctor. It's particularly common with males, although not exclusive, especially young males, as that is where the peak incidence is for primary bone cancers. That's a major issue, because we don't like to go to the doctor and say I've got something wrong. We try and avoid it. So that's been highlighted by NICE as an issue for society. They also say GPs also need a reliable source of information. This will cover a number of areas, such as raising awareness of sarcoma and providing information. So what they're also saying is there's a problem with the GPs as well. So they're not diagnosing necessarily when that person finally goes to the doctor. So they're highlighting two sides of one problem. So that's where our problem lies, and that's what we've got to address. Now, we're taking that into consideration, they also say delays in diagnosis for both bone and soft tissue sarcomas are common. The median size on presentation for both is 10 centimetres. Earlier diagnosis would undoubtedly lead to improved outcomes in terms of both survival and of less damage and surgery being required. Right, so if we can get people to go to the doctor earlier, and we can get doctors to consider an x-ray if symptoms present themselves, we'll reduce the amount of surgery required, and we'll save people's lives. That sounds simple. So that's what we've got to do. That's what we're aiming to do. We then considered how we put that information into public domain. Now, initially, the first thing we did was create a website so that there is open access to information on the internet. However, the problem with that is people will only access it if they're looking for the facts. Okay, so there must be a term that they type into a computer that will link them to that website, which is not just going to appear on everybody's screen. But the information is there. So that was our initial task, just so that there is some information in the background. Now, we then began a process of consultation, which I'm going to cover in more detail on another slide in a minute. But they decided the best method of distributing that information, the consultation, I'll tell you why, was by producing an information leaflet that would be made available to anybody attending or working in a GP surgery. So there's a prompt there for anybody who goes there. That's the plan. So anybody going for a first-line medical appointment, whether it be a GP surgery or minor injury, whatever, eventually will have access to this information. This in turn could lead to the earlier consideration of x-ray problem, therefore obviously an earlier diagnosis. Right, we set up the trust in February last year, so it's a year and a half now really. Since then, where say we've been ticking away in the background, we've been running a pilot project in Cornwall and the Isles of Scilly. The reason it's Cornwall and the Isles of Scilly is because that's where the family are from. Okay, and that's where Luke lives, so that's where we're based. That's all. Okay, it's not because of any particular reason other than convenience. Now this pilot has been run in cooperation with the Department of Public Health, Cornwall and the Isles of Scilly, or the Primary Care Trust, and the Department of Public Health. As a result of that pilot, our leaflets are now available in all GP surgeries and in all minor injury units throughout Cornwall and the Isles of Scilly. I say they're available. They're available. We can't make GPs display them, okay, but they have got them. Right. This is the key point, really, for us being here, the reason for us being here, and what some things we'll discuss this afternoon. The consultation process, we began by establishing a relationship with relevant key personnel within the PCT. And we discussed with them at length different options for distributing this information, how to get this information into the public domain. The first contact we made was with the Director of Public Health, which is a lady called Felicity Owen, for that particular region. Obviously, we had to do initial introductions by email and the likes, but it led to a series of face-to-face meetings. What was particularly encouraging we also needed to seek, obviously, detailed information to make sure that what we were saying was correct. So we came back to BCRT, back to NICE, and also, obviously, presented everything we wanted to publish to the local department. Now that was quite a lengthy process, so it was a year and a half in all, although it actually took us a year to get the thing published and into sort of the national health stream. But that process involved readability checks, the likes, to make sure that what we put in a doctor's surgery is acceptable and readable to anybody who is within the target audience, so any teenager upwards. So all that had to be done and agreed. It was agreed with yourselves, so they basically didn't tell you, but with the boss. Regarding the content and the look and everything else. So once all those agreements are done, we then went to production and distribution. Now, part of the consultation process was, once it was agreed that we could do it and that they were happy with what we were going to do, was how to get it out there. So another part of our agreement was that the National Health Service would distribute this leaflet for us. So within that PCT, the National Health distribute that to all GPs. So it's quite easy for us really. What we're looking at now is printing a document, sending it by a courier to a distribution centre, and that's it. Okay, the only thing we need to do is negotiate it into that system at a local level. And that's what we're looking for you to do for us. What we intend to do is recruit regional volunteers, or local agents if you like, who would consider approaching a PCT or Department of Public Health in their area with a pilot, with a programme already written for them that we will provide you with, to say this has already been done and we'd like to do it here. Okay, terrifying. But that's the plan. Initially, we planned to look at each region because of incidence rate. So each region would be on a priority with where the most cases of bone cancers were. that isn't actually practical, because we'd sit there waiting for somebody in that region to be available. So we're not going to do that. What we're going to do is wait for people to say to us, yeah, we'll do that, and you can take it away to wherever you live, to your local area. That's the plan. Additionally, also, we'll continue to seek opportunities to promote this in schools. That isn't something that's actually, we've formed a model for yet, but we're still working on that. So that's something that we'll also continue to do. Any questions? That's been the message. So
yeah, just to let you from there, put me down straight away for that. My daughter's doctor is actually the head of our Care Trust Plus for our region.
okay, thanks, mate.
So we've got that straight away. I'm also been doing a little bit regarding the local news and media within our area. And we did everything within the up north last week within the schools. So we've got a good approach in Humberside, Lincolnshire way into schools already and sports facilities. So
Brilliant.
we can really do a lot there to help you, no problem.
Thank you very much. Just